get started? All right, Sherry, thank you. Good afternoon and almost noon, everyone. Happy New Year. As many of you know, I am Mark Giordano, your CEO, and I thank you all again for joining us today. We ended calendar year 2020 with seeing the light at the end of the tunnel, and that light was being powered by the availability of the COVID-19 vaccine. And we also had an understanding at that time that while there was light at the end of the tunnel, that there was still a long path for us to navigate together. And over the past couple of weeks, that's been validated in that we have seen an increased number of cases. We have seen an increased number of deaths throughout the country. And then we've also seen the challenges that, I think many of us can anticipate, the challenges relating to administering and creating access to the vaccine. So again, very evident of the complex and uncertain path that's ahead of us, even though there's some light at the end of it. But as we did through 2020, and as we will do through the upcoming months, we'll work together with and through this uncertainty. No doubt we can do it, and we'll work through it with all of the information that we have available to us, with a shared goal in mind, a goal that I think everyone on this call and probably everyone in our community would support, and that is ultimately providing a safe, healthy, and supportive environment for the folks that we support, for each other, as well as our families. So I hope you all will join me in still having that goal very much in front of us as we work together through the continued uncertainty around the pandemic. We are learning more and we've learned more over the past couple of weeks about how the vaccine's being prioritized, the distribution of the vaccines being prioritized. And we're beginning to understand how and when the vaccine will be accessible to the folks that we support, as well as our staff. So over the past couple of weeks during the holidays, we've had some continued dialogue, and we continue to receive the information from various state and local government, as well as the federal government. And we've decided to create a vaccine committee that will allow us to ensure that we are managing and sharing the knowledge around the access to the vaccine, as well as how, as RHD, we are ensuring that access is proactively managed for the benefit of the folks we support and our staff. So the committee is forming, and we'll be touching on that as part of our agenda this afternoon. So stay tuned for a little bit more insight into how that group is beginning to come together. We've also, as I mentioned earlier, have seen a significant increase in cases and deaths across the country. And I think with the increase and with the magnitude of the number of cases that we're seeing, that there probably, it's realistic to maybe make the assumption that each of us has had someone that we know, that we care about, that's been impacted or that's had COVID-19, or that possibly has died as a result of COVID-19. We've talked about in the past our COVID fatigue, and the need for us to acknowledge that, as well as embracing what we have known over the past 10 months to become our new normal. And we're all embracing that in our own way. As the saying goes, we're all in the same storm, but in different boats. I do think it's important that we are continuing to embrace the new norm, continuing to embrace the protocols that we've had in front of us. 350,000 people, 350,000 human beings have died as a result of this virus. that we can't have the numbness of the uncertainty or the embrace of the new norm cause more people that we care about to pass. So we must continue to follow the protocols, even when the vaccine is administered. We must continue to follow the 4 W's. Heard a great one over the holidays, which I think will continue to apply. Wash your hands, watch your distance, wear a mask, and wait on gatherings. You know, this time will pass, and the opportunity for us to get together with the folks that we care about will soon surface again. So I ask you, as we continue to work together and we continue to understand how our environment is and what we need to do is continuing to be the same and also changing as we learn more each day, that I ask for you to continue to embrace the message of following the 4 W's within your daily work lives, inside of work and outside of work. Because ultimately it's about creating an environment for all of us to feel safe and to be healthy and to be supportive. And you know, what you do, what each of us does will impact others within our community. So let's continue to create an environment where I'm doing everything I can to keep you safe and you're doing everything you can to keep me safe. So with that, I'll turn the mic back over to Sherry, and I appreciate you all again for joining us this afternoon.
Great, thank you, Marco. All right, so we had a lot of people join since you started, Marco. So the agenda today, after this housekeeping, is an update on the vaccine committee. Deanna will share a little bit more about the funding. Brian will give his usual COVID-19 update that gives us a sense of the numbers. And then from there, we'll open it up for some Q&A. And then as always, some closing remarks from Marco. We encourage you to submit your questions. I will say we are seeing a real uptick on people using these other vehicles, so that's great. The COVID-19 inbox, I think, had something like 47 either comments or questions, so keep them coming, send them in before, that's fantastic. And then of course, Zoom chat now I think becomes our second most popular way to ask a question. And we have folks on the call today who will be monitoring them. So we will answer the questions. Sometimes you will see them responses typed in chat, but we will also make sure to always read those out loud so those on the phone can hear them as well. So let me pass it over to Linda and Brandon to give an update on the vaccine committee.
Hi, everyone. I'm Linda Donovan, the Chief Program Officer for Behavioral Health and Housing Services. And as Marco mentioned, we are forming our vaccine committee. I think we are all so grateful for the hope that the vaccines are providing. You know, we're ready for it. We've been waiting for this for a long time. So with RHD, though, for the vaccines, we do many types of service in many different places. And states and even counties within states have different priorities and practices and ways that they are rolling that out. So what we want to make sure that we are doing is that we have all of the right people at the table to help us understand our access to vaccines. And that would be having representation and leadership from each state and possibly even from each county in Pennsylvania because of the spread of counties throughout the state. We want to make sure that we are, as we're thinking through this, that we have our HR business partners involved, we have our legal team involved, and we have our DSIC team involved. Because this is a very complicated issue, it raises a lot of feelings for people, and we want to just make sure that we're having as many people as possible really helping us get to our best answers. I do want to just clarify that we ourselves are not providing the vaccines. We are trying to figure out how everybody can be getting the vaccines. And, you know, where are we a priority population and where are we not? So that will be coming out. The vaccine committee will probably be meeting tomorrow or the next day. and really quickly getting information out to people as fast as we're able to find it and package it and get it out to people. Just wanted to let you know that. Oh, I wanted to check in with Brandon just to see if there was anything else that you wanted to add around the startup of our vaccine committee.
No, I don't believe so. I want just to make a statement that, to be clear, we are not currently mandating folks to receive a vaccination. So I want to make that clear to everyone as well. So I know folks are asking that, are we going to have to take it? Do we have a choice? It is not being mandated. And again, as Linda just kind of alluded to, and we'll probably go into that in a moment, is that we are also not going to be administering the vaccination ourselves. We will be working with other parties who are trained to do that. As you can imagine, it's not an easy process for either vaccine. There are multiple steps. There are safety procedures, and we are not at this time, again, mandating, nor are we administering. So we will be partnering with other organizations to do that. But I think you've got a good start, Linda. I appreciate that.
If anybody does have questions about their own personal issues with respect to the vaccine, please do contact your healthcare provider. They can help you also navigate what you need to do for yourselves.
Yeah, I apologize. One other thing I will say on the committee, Linda mentioned that we'll have a multidisciplinary team involved in the committee. And I will say, just from the folks, specifically IDD, and I know Linda's team as well, we will have a good mix within those folks. So just to give you an idea, we've got RNs, we've got nurses involved. We've got program directors who have stepped up and said they want to do it for their state. We have regional director, we have unit director, and division coordinators, in addition to HR, legal, and risk. So I just want to give everybody a good feeling that we will have a broad spectrum viewpoint from each state and on that committee. So it won't just be a bunch of, divisional or up folks making those decisions. These will be programmatic, these will be clinical, these will be risk, these will be HR. So we will have the full gamut represented at the table, as Linda stated earlier, just to make that doubly clear.
And we'll be sharing out as that team is formed and the actions that are being taken, we will share that out continually as new information becomes available. I did see there was a question that came in the chat around changes when someone has the vaccine, and what we would share is our guidance from our healthcare professionals as that comes up. But we don't anticipate any change in our practice or protocols for quite a long time. But we will, as we have new information, we'll share that. So that's really all right now that I wanted to share, Sherry, on the vaccine committee. So back to you.
Okay, great. Thank you both for that information. We'll look forward to future updates on that topic. And now Deanna is going to talk a little bit about the HSS funding. Deanna.
Good afternoon, everybody. I hope you're doing well and enjoying the new year. No, I am, with hopes of vaccine on the horizon. Last time we were together, I shared that we had received the HHS funding, 4.6, the first wave. There is supposed to be a second wave. I still have not confirmed receipt of those funds, and we do not know the dollar amount of the second wave. But I shared last time we were together a bonus that we were going to pay using the HHS money for the organization for all the staff who have not received the COVID bonus to date. Our ability to give a bonus changes based on the funding stream. So certain funders, like certain areas, Delaware is an example, the state has provided us CARES Act funding where we were specifically giving COVID bonuses. So those individuals received the bonus. There are others in the organization who have not. Those who have not will out of the HHS funding. The bonuses will be paid on January 15th, as I shared previously. You will have to be an active employee on January 1st to receive the bonus. And the bonus is for all full-time or part-time employees who have worked 20 hours or more since mid-March with RHD. If you are a furloughed employee, you will be getting a different bonus of a different dollar amount when you return to work. The bonus for our full-time and part-time active employees that will be paid on January 15th is $1,000 for those who are full-time and $500 for those who are part-time. We will be sending out a communication later on this week. I would expect to see it on Wednesday if I were you. I'm hoping for Tuesday, but I don't want to promise. And that will detail very clearly who, what, when, and where. I have to step off of this call at 1 p.m. So if there are any questions, please put them in the chat. They'll get them to me, and I will make sure that the answers are addressed in the communication that will be coming out. Just checking my notes over here to make sure I got it all. And I think I did. For a recap, if you want to see the details of the last meeting, I know that the meetings are videotaped, but I think I got everything. If there's any questions, let me know. Thank you.
Thank you, Deanna. And I am hoping that Brian is on the call to give us an update now on the COVID-19 numbers.
Thank you, Sherry. I am on the call. So good afternoon, everybody. I'm Brian McHale. I'm the safety manager. I'm here to share the COVID-19 summary with everybody. So currently we have a total of 1,925 reports since March. So the breakdown of that is 565 confirmed cases, 926 negative, 91 suspected, and 342 possible exposures. So what I'm going to do at this point is I'm going to share my screen with you and show you the graph that we've been looking at for the past few weeks, just to get a sense of what we're looking at. So, okay. So what you should be looking at now is my bar graph. And what you're going to see is, from your far left, you'll see where the beginning of the pandemic was back in, March and April. And then you'll see that plateau, that lowering of numbers as you kind of go through the late spring and summer months. And then you see that surge we've talked about starting in about late October, and then it continued through November and into December. So what you are seeing now is that over the past 2 weeks or so, there's actually been a bit of a downturn in the number of reports that we're receiving. So those weeks ending on December 26th and January 2nd, there's not a lot of reports there right now. And honestly, what we think this is it just might be due to time off, vacation, those holidays where people may not have been able to turn these reports into us. And, we really expect those numbers to rise over the next 2 weeks, especially, we're still going to be in that 14-day window since, Christmas. So we're going to see things develop over the next 2 weeks, especially, and through the end of January. So, we see that and we're going to monitor that. So, just to kind of give us a national perspective, as we do our reading and kind of look at what happened over the month of December, December was not a good, good nationally. There were about 6.4 million people who were infected with COVID, and about 77,000 people lost their lives in December due to COVID. So to put that in perspective, we looked back at November, in comparison, and we saw about 4 million people contracted COVID, and about 37,000 people had passed away due to COVID. So December was a really rough month nationally. So, we really need to, like Marco said, continue, looking at the CDC guidelines, following CDC guidelines and the RHD protocols. We want to make sure people are, sticking to that, looking past some of the COVID fatigue that I know a lot of people are experiencing right now. And, wearing your mask, maintaining social distance, avoid those crowds and poorly ventilated areas, and wash your hands. Those are the things we're really looking at, and avoiding travel, making sure that we're not traveling unnecessarily. So with that, my summary is fairly short this week, Sherry. I'm going to turn this back to you and stop sharing my screen.
Great.
Here we go.
Brian. Thanks, Brian. Always informative. So we had a pretty short agenda today, so we can go right into the question and answers. We have Hannah and Peter and Sarah helping us out with that. So I'm going to just pause a minute for them to, just take a quick look. And Hannah, I'm going to start with you. Any
Great.
questions in the chat?
Yeah, I have two. Some of them were answered in the chat, but we're gonna read them out loud. Or read the questions out loud, have them answered out loud as well. So one was just asked, can we, if most of the direct care employees are opting out of the vaccine, can more educational opportunities or info regarding the vaccine be provided in hopes to reduce fear?
I think Rebecca Bixby gave an excellent presentation during a recent town hall. Is Rebecca on the call? Maybe she could make that available. No, she might be able to make that available in some other forum.
Yeah, I think definitely the vaccine committee can reach out to Rebecca and others at FPCN for guidance on how to incorporate education. And to the questions, we did actually talk this morning in our COVID committee meeting about a survey, trying to gauge, what is people's reception and concerns that they may have about it. So that work will be incorporated into the vaccine committee as well.
Can you go over the steps programs need to take when an employee contracts COVID-19, i.e. when to contact risk management, when to contact WC, I don't know what they meant by that, which leave of absences to property protect employees' benefits?
Okay, the COVID-19 reporting guidelines are in our COVID-19 info protocol sheet. There's a special section on that. So when somebody reports that they have been exposed, that would be maybe a possible exposure, someone they knew was exposed and they were sort of, a few distance steps away, but they felt they might be exposed. That gets reported as a possible exposure. A suspected exposure is a direct exposure with someone who has COVID-19. Those things are to be reported, or those incidents are to be reported immediately through the COVID reporting form. It's a fillable form. It's on the COVID-19 site. You can contact safety@rhd.org to submit it. Or if for some reason you can't find it, we can also provide a form. We prefer you get it off the site because by now, after 9 months, you should have had access to that. But we'd certainly be glad to help in that regard. Any of those situations, please report immediately. Even if someone in your family that you're living with in close proximity gets COVID, that's a situation where you would need to quarantine, and we can walk you through those steps. As far as any other benefits, I know that there are some payroll benefit issues or HR issues that can be discussed with the benefits department. There's time donated for people out of PTO. And we will take a good look at the form to see whether or not you contracted COVID-19 at work. That would be a workers' comp. So that's kind of the steps as far as that. Immediately report, use the reporting form. And that way we will certainly be able to help you find out what benefits you're entitled to.
Great, thank you, June. Betsy, were you going to jump in there?
Yeah, so I was asking that, give an image. I was asked to ask the question by my coworkers since I'm the one listening primarily. I know that from our end on payroll, there seems to be confusion and delays in both potentially reporting to risk management and the sending of leave of absence forms before or concurrently with contacting risk management, which creates sort of issues since we don't know if the person contracted it at work, which means that the paperwork should be for workers' comp, not for 1F if they are FMLA eligible medical leave. And then there's the other issues. For instance, if someone works under a year, they're not eligible for 1F FMLA because the federal bill did not add additional protections. And so employees who in fact are under 1 year aren't eligible and therefore must resubmit as 1H, which is COVID loss of hours, because that is the only way that individuals will not stop their PTO accumulations. And so it seems like there's still some confusion in how people are following through about when we're getting paperwork about which steps people need to take, which is one of the reasons why we were asking for a further follow-up, just so that some people learn better verbally. And I feel like perpetual repetitions are important for all of us. So
yeah, I think we talk about this every town hall, so it's not a problem. Certainly be glad to go over it again. But that's the COVID reporting tool is the way to report a COVID exposure, COVID positive, COVID negative. We follow up. It is, the follow-up is probably not super timely because you have to wait from the exposure to when you actually get COVID in some cases. So there is a delay in that. We do put it on the sheet that is used by the fiscal managers to determine who is entitled to hazard pay, a benefit, who's entitled to workers' comp. We look at the dates, and then that is all determined from those reports. So that's why it's important to get those reports in a timely way. FMLA runs concurrently with workers' comp, and that's just a, like, I don't know if Alicia's on, she can speak to more about FMLA or Bonnie or somebody else in HR benefits, but that has no monetary benefit associated with FMLA. It's just a time period that's calculated for job preservation.
Oh yeah, I just wanted to add that in that, like, if you're on to FMLA, there's short-term disability and other benefits that employees can get access to in the loss of work. So although FMLA is a timed benefit as it relates to illness, it's also concurrently connected to larger medical sort of payments that can come out from our benefits. So
Yeah, it's totally a different body. It's a different regulation from short-term disability. They may look like they run together also, but it is separate. But yes, there are definitely time periods that need to, or hurdles on time that need to be lapsed as far as your tenure with RHD for your entitlement to certain benefits. So again, if you're not sure, contact the HR benefits department.
If I could just jump in, and thank you, June, for your explanation, and Betsy for you sharing the question from the team's perspective as well. I do think that, as I think we're hearing today, it is complex. It is complex in terms of the various types of benefits that are available, and our goal here is to make sure that every employee has access to the benefits that he or she is eligible for. And as Betsy, if I heard correctly, sharing, it's key to make sure in June.
Is everybody hearing what I'm hearing? Because all these voices are clashing together in this conversation. That's what I'm hearing. I hear like 3 conversations going on.
Okay, so let me just, Brian, can you make sure everybody is muted? Sounds like not everybody's having that issue, but let's just give Brian a second to make sure everyone who should be on mute is on mute so we can hear Marco loud and clear. Elizabeth, is it better now? No.
That might be, yeah, that might be just
the same. It's like 3 conversations going on at one time.
Elizabeth, that might be your Zoom, so maybe sign off and sign back on. Yeah, okay. I think it might. I think everything's fine.
Okay,
on the broader spectrum.
Yeah, everyone is muted.
Yeah. Thank you, Brian. Thank you, Sarah. Thank you, Elizabeth. Okay, Marco.
So just to sum all that thought up, I think it would be helpful, and maybe Betsy, yourself, and maybe June and others can talk more offline when Alicia returns, to maybe take some time in one of our next meetings to really walk through that process. I know it's captured and it's documented and what we're asking folks to do out on the COVID site. In terms of payroll and the necessary change forms that have to be submitted. And as June said, the reporting requirements are captured in a protocol document. But as Betsy shared, I think, talking through it and maybe having the visual that really walks us through that process might be helpful for the larger community. So let's put that on the list for consideration. And again, thank you, Betsy and June, for both of your thoughts.
So thank you. I'll take that as a follow-up item. So I am going to turn this over to Sarah, who I believe has consolidated a number of questions.
I have. Okay. So somebody asked about protocols, and our response has been to let your supervisor know if an employee is not following a protocol, a COVID-19 protocol. And this person asked, what if it's your supervisor who's not following that protocol, like wearing a mask? Who do you report it to?
Oh, in my book, I would report it to their supervisor and let's have bring concerns about when it happened and why, and how it's not going to happen in the future.
Yeah, I appreciate that, June. This is Brandon. I would agree. Let's hope it doesn't come to that, but it sounds like from the questions angle that maybe it already has. So I certainly would agree that you run it up the chain of command. If you feel uncomfortable doing so, or you feel like you're not getting anywhere with that, or that's a difficult decision for you, then go up another level. Feel free. I know Linda and I have said in the past, and I'll say it again today, Emily as well in the past, let us know that as well. We're not saying we don't want you to tell us. That's not the issue. But we want you to have relationships with the supervisory, chain of command. So it's our goal that we're all communicating with one another, because this is a very important topic, for the safety of our clients and safety of our teammates. So we do want to make sure that you're comfortable sharing concerns, that you're able to share if folks aren't following policies, and really educating folks on why we need to do that. So as opposed to coming from an angle of sort of disciplinary or that type of approach, we really want to come from an angle of education, support, and encouragement to give people the ability to feel good about following protocols, why they're doing it, because ultimately that's how we get the best buy-in and sustainability, is not through hard enforcement. That's one way, but we really don't get change unless we get people to buy in and understand the need for safety. So please, please hear the vein in which that's given. It's not to get people in trouble or to tattle. It's really to make sure that we're practicing safe protocols and that everybody is doing that consistently across the board. If you have questions on it, again, please reach out to Linda, myself, or Rebecca Bixby for healthcare right now. Let us know, and we'll be glad to follow up with you as well.
And if you have concerns, you can always send an email to safety@rhd.org.
And if you still have concerns after sending an email to risk, you can always send an email to marco@rhd.org. Following our protocols, and everyone following our protocols, is extremely important for us as an organization. As Brandon said, it's not from a disciplinary standpoint. It's from really helping folks understand the importance and understanding the barriers to ensure that we are doing what we need to do as an organization.
All right, thank you, everyone. Sarah, I think you have some more.
Yes, so we got a handful of questions about the vaccine, and not specifics about the vaccine itself, but more about our plan. Folks are wondering when employees, specifically nurses who work for RHD, might be eligible for an earlier round of the vaccine. I know you already spoke to this a little bit, but I don't know if folks want to give a little bit more details.
Yeah, I would just,
and then, go ahead.
No, go ahead. You're good.
So the other was more about what our plan as an organization is to continue to encourage our staff to get the vaccine, because we're not requiring it.
Yeah, great questions. As we kind of alluded to earlier in Linda's comments, the unfortunate part is it's different for different states, different locales, right? And even different positions within those states. So I'm going to address the first question first. Nurses are in that group of folks with our DSPs who are doing direct service, direct support work, and there are a few others in most of our locales that are going to be in an earlier round of vaccine distribution. That doesn't mean, or eligibility, I should say. And eligibility does not mean distribution or administration. So I want to clarify that. Even though certain positions may fall into eligibility, some states are not getting the vaccines that they first thought they would. Some states are getting more than they thought they would. So it really differs by state, and in some states by county. That is why this committee is so important, that we're going to have each single state represented, right? We're going to have folks who are researching that, who are up to date with eligibility, up to date with availability, and up to date with where can folks get the vaccine, right? Because again, we're not going to be an administering agency. We are only working with folks to have that availability and to get you into contact with the right people to get the vaccines administered. So I think that while I would love to be more specific, unfortunately at this time, we just don't have the ability to do that. Once we get that state specific information, we will continue to provide routine updates to everybody in the company. I'm certain that we'll discuss it on our town halls, but we will probably also do a routine communication to the entire organization that says, here's what we know about these states and why, just to keep folks updated. So that the committee will decide that. I won't decide that, so I don't want to throw that out there for certain, but I know it's something that's on the discussion table right now. So that would be important. And I got to talking there and I totally forgot the second part. I thought I had an answer. Can you repeat the second question, Sarah? I'm so sorry.
Sure. It's what our organization is going to do or is doing to encourage our staff to get vaccinated if we're not going to mandate it.
Yes, thank you very much. And we actually just discussed this morning, so it's hot off the press. So hear me again. The vaccine committee is discussing this as an option, but we are considering doing a Survey Monkey style poll to see where folks are. I saw in the chat earlier that folks are saying the majority of their folks are kind of scared of it or have a lot of questions. That is our goal, is to get that feedback from our staff first as we work on the opportunity of, again, exploring eligibility and availability of those vaccines. The real key for us is to educate, and to repeat, right? Just as we heard, we learn, people learn in various ways. They hear in different ways. Folks attend some meetings, not others. So I encourage you as leaders, I encourage you as middle managers, as frontline staff, all of us in the organization have to do our part to make sure that we are communicating what is available, where we are with things, and we will try to do our best to get that information out to you as we know it. So again, the short answer would be we're going to take a survey of some sort to get where folks are, and then we're going to try to hone in where do we really need to focus on the education piece and the communication piece to make people feel more comfortable.
If I could just add quickly to that, as Brendan shared, we will be continuing to infuse our conversations and our education with the expertise from our health centers, but really wanting to understand further, where is the fear? What are folks concerned about? So we can really make sure we're tailoring that education as we move forward as well. And I do think it's also important for us to be talking with each other, right? And, we're all in the space of evaluating whether or not we're going to get the vaccine. And I think sharing our decision-making, sharing our thoughts with each other is also a way to help each other along that path. So I would encourage folks to be talking about it within your small groups, one-on-ones, and to be open where you can be as to why you're not pursuing it. So that way maybe you can hear a different perspective that may or may not help you better understand some of the variables involved.
We will also be encouraging folks to speak with their primary care physicians when they have specific medical risks or concerns that they think may affect whether or not they should get the vaccine. It is a personal medical decision for folks. So encouraging folks to reach out and speak with their own PCP is something that we'll incorporate into the plan.
Thank you, everyone. Sarah, one more, and then we'll pass it back to Hannah.
Sure. Should coworkers know the identity of an employee being tested for COVID due to a potential exposure? Is this protected health information? Maybe June?
Nobody should be revealing the identity of anybody who has submitted a report that perhaps they had an exposure, they're getting tested, etc. There can be information relayed that there was an exposure at this place at this time. And so if anybody else was possibly exposed, then they know what to do.
Sarah, do you have more? We can stay with you.
I do have more.
Yeah, keep going.
I believe June spoke to this a little bit earlier, but I'm going to ask it again in case there needs to be clarification. If your clients are COVID positive and staff also test positive, why do we have to use PTO and vacation time for the 14-day quarantine? Why does RHD not give you those days with pay?
That is currently not a benefit from RHD. If anybody believes they contracted COVID at work, they need to obviously submit the COVID reporting per the COVID reporting guidelines. We do look at the dates. We ascertain whether they were exposed at work or somewhere else. And then they can, if they want, submit to apply for workers' comp. If there's an investigation, the carrier will do due diligence on their particular case and inform them whether the claim has been accepted or not for any benefits. I have not determined who these people are, so I can't really speak to those sets of circumstances. Each case is different, does have different outcomes. It does involve different types of benefits depending on the situation.
Thanks, June. I have a couple more. Regarding the bonus that Deanna spoke to earlier, and I know she's not here, but I think someone else might be able to take this. When she mentioned all full-time staff will be getting the $1,000 bonus, is that only for staff working within programs, or is shared services getting the bonus too?
Yeah, I'll take it if someone else on the committee wants to chime in if I missed something. It will be for all staff in the organization, all full-time and part-time staff. And again, just to make it doubly clear, the $1,000 is for those who have not received a bonus yet. If you did already receive a bonus that was $1,000 or in excess of that, then there won't be an additional $1,000 bonus. If you received less than $1,000, you'll be receiving a differential payment, which would be the amount between your prior bonus and $1,000, just to try to clarify that a little better. The communication coming out will have bullet points stating those, so I don't want you to feel like you have to understand it completely today. There will be a full communication coming out, but that will be for all staff in the organization. Active, sorry, let me correct that. Active, if you're not active, then you would not be eligible. For those who are currently furloughed or on a leave of some sort, they will be eligible upon return, and that bonus will be stipulated at that time. That is a different bonus. So again, you have to be active at the time of the bonus.
And I believe it's prorated for part-time versus full-time.
That is correct. Thank you, June. It's $1,000 for full-time, $500 for part-time. Thank you very much.
Someone asked, are unit directors and fiscal administrators going to receive something in order to verify the correct employees are receiving the retention bonus?
I would encourage you, and in fact, I know most of you are already. That's a great question. I would expect as leaders that we're doing that already to clean up any folks that have been terminated who are not terminated in the system. We need to make sure our paperwork is up to date from the standpoint of payroll, from the standpoint of benefits, from the standpoint of any, basically just updating our systems, because we do not need people on the roster who are getting benefits, let's say health benefits, for example, if they're no longer actively working or actively furloughed, I should say as well. It's kind of weird, but who are furloughed but have not yet been terminated out of the system. You guys, we would ask ongoing that you do review that. You know, one fear we have discussed during COVID is that we have folks who are receiving benefits from us who actually have taken another job after they've been furloughed. We need to make sure that we're communicating with those employees and our lists are up to date and accurate. And that then secondly, that our system is up to date and accurate. So if you would, I would encourage you, if you're not, please check that every payroll to make sure that you have the same people that are in those lists and that it's consistent. We do know there's a time lag. So from payroll to payroll, you might see someone you've filled out the termination paperwork for, but it's not shown up in Lawson. That does happen. So don't be alarmed if it doesn't happen for a couple of pay periods. But if after a couple of pay periods, it's still not there, you need to follow back up with payroll and benefits and make sure that that termination paperwork is in the system and that it's up to date. That's the best protection we have. So I will tell you, you will have the opportunity. The plan is that you get to compare your list with payroll, but the list that payroll is using and that they are using to evaluate that is Lawson to start, right? So we want to make sure that information is correct in Lawson. So please go back. I mean, I'm encouraging you to do it right now, you know, after the meeting for the next couple of days, go right back and check, because we have a cycle coming before those are issued. Let's do our very best to make sure that all of our records and systems are up to date.
There's a question in the chat about Lawson. Don't know if anyone can take this one related to what you were just speaking about, Brandon.
If someone is in Lawson, are they still active? Meaning, are they shown as an employee? If they're still in Lawson, that's correct. You want to double check that again. There is a bit of a lag, so it's not always when you fill that. That's correct. Hoy's saying if they work hours, correct. So if they'll have a check obviously showing in a pay period if they work hours. So if they're actively working, yes, they're going to show up in Lawson. If you've got somebody who is gone from they're not working, but you still see them in Lawson, that means you've got a problem if you're beyond 2 pay periods. So if you're like a month out and you're still seeing them in Lawson, you need to follow up with payroll and benefits on that termination paperwork. I would suggest, and I hope you're doing it already, but I would suggest, again, if you're not, and if you're not, please start, that you keep a copy of all those submissions of your termination paperwork, because things do happen. So it's easy if you have a copy that you've got either an email receipt or you can just resend the original email that's got all the paperwork on it, because we want to make sure we have good documentation that we're doing our part on the programmatic side to make sure that payroll can do their part. If we don't do our part, they obviously can't do theirs. So it's really a matter of us making sure the paperwork is submitted accurately, completely, and timely. And then if we don't see it show up, that we follow up with Bernice and her team to make sure that they're getting what they need to follow through in the system.
I just wanted to jump in for 1 second. For the checks that'll be processed on the 15th, if anyone is in a leave status, a check won't process. I just want to run that by everybody. So even if someone's in a leave status and as an error, those checks won't process. We will, like Deanna said, as people come back, everything will get reviewed again and the checks will be processed at a later date. But if someone is currently in a leave status, those checks won't process. And I would suggest too, as far as your termination form, if you don't see it processed even within 2 weeks, just to reach out to your payroll coordinator, because there definitely shouldn't be a lag time of a month. They should process for that next payroll. The only reason it wouldn't is if it was turned in after the paperwork deadline and we aren't able to update it while we're running a cycle. But other than that, they should definitely process quicker.
And I just want to, I'm looking at the chat. So it sounds like if you've got a problem, someone's been gone for a long time and you're still seeing their name, you need to reach out voice to your payroll coordinator and get that resolved. And obviously even more important right now. Yeah, so this is one of those, you gotta pick up the phone, go old school, and make sure you get that resolved. Anything else to add to that, since there's a lot of questions here? So the form is on my RHD. It is not fillable, but you can type into the form. Betsy is saying emails are better than phone calls. Maybe put a read receipt on the email, but something that really ensures that you bring this to closure. Any other comments, thoughts, important information on this topic? Okay, Sarah.
That is all my questions for now.
Great, thank you. And then Hannah, I think there was one in the box a while ago. Do you want to read that one, the question and response?
If you are in the office / space by yourself, do you still need to wear a mask? And June, you answered that in the chat. If you could just answer that out loud.
Oops. As long as nobody's coming up to your desk frequently, if you're sitting isolated at your desk by yourself, then you may remove the mask while you're sitting at your desk. However, when you get up to travel around, just because you never know who's going to be around the corner, please keep your mask on. Thank you. Even if you've gotten vaccinated. Thank you.
All right, I think that concludes all of our questions. So Marco, maybe we just pause, make sure there's nothing else that's going to go in the chat. Speak now in the chat.
And while we're waiting for folks to surface any remaining questions, I just wanted to provide a point of clarity to a statement that we've made in this conversation in terms of us not administering the vaccine. That is a true statement. However, our health centers is designated to be a provider that is able to administer the vaccine. So we will be doing such as part of our health centers in that controlled environment with skilled resources, as we mentioned in the call earlier. And how that ultimately will be an advantage for us will be dependent on how many vaccines the health center has access to and what the state sort of governs in terms of how they should be dispersing those vaccines. But we are hopeful that for the Philadelphia, for our staff in Philadelphia and our staff and our consumers in our Philadelphia program, that because our health centers are a site that is administering the vaccine, that we may have the door might be a little wider open or easy access to the vaccine as we learn more information over the next few weeks. They are supposed to get their first delivery of the vaccine at the end of the week.
Thank you, Marco, for that clarification. I was curious about that one myself, and I think we just got a question in, or a comment. Wait, comment.
I know Alicia just put something in the chat, and maybe that's helpful for her to share out loud. Alicia, do you think you could do that?
Sorry, I didn't realize I was in as Alicia, not Alicia. Yeah. So the comment that I made in the chat was regarding PTO. So what I get a lot is a lot of individuals asking about the COVID bank for PTO, for the COVID sick bank. There's not a separate COVID sick bank. If you have it in your sick balance, that's kind of what we use. So if you don't have it and you're going negative, like we allowed everybody to go negative last year as to what you would have accrued until the end of the year, as long as you earned it back by 12/26/2020. As of right now, I don't believe we're allowing individuals to go into the negative. So unless they don't have it in their balance, they can't use any extra sick time that they have to use the sick until it's completely depleted. Then they can use their vacation. And then I don't know if a lot of people know this either, that we need to have, if someone is getting a PTO donation, they have to have completely depleted their PTO balances. They can't have, one accrual in there or anything like that. We need to make sure that it is absolutely depleted, and then we're allowed to process the donation that they have, whether it's individual to individual or through the COVID relief fund that we have. But as for the comment that I made in there, again, just want to reiterate, there's not a separate COVID balance. Your sick balance is the sick balance that you're using for COVID or regular sick. And then, okay, somebody else asked a question, not my part.
Amy, thanks for the clarification on the PTO, and hopefully someone's going to take the one about the vaccine. How
Yeah, so
vaccines are arriving.
yeah, I'll take that as probably in response to what I shared with the health centers. How many vaccines are arriving? What staff will be vaccinated first? I can't speak to how many vaccines are arriving, but again, what I will share with you that the patients of our health center and the staff of our health center will be prioritized with the vaccines that are received. That's not an RHD decision. That is, again, the nature of how the vaccines are being distributed to federally qualified health centers. And then again, if I'm not sure if everybody heard, and I think this may be a national requirement, that the federal government's asking each of the entities that are receiving vaccines, which thus far have been larger healthcare systems, to allocate 10% of their receipt to other providers and other prioritized individuals within their communities. Processes still to all be worked out in terms of how that's going to work. So again, that raises the question and really opens the door to the extent that our FQHCs receiving vaccinations, meeting that 10% requirement of being outside. It could be larger to the extent they have more vaccinations than needed for their immediate population. Again, how do we make sure that that excess or that 10% gets directed to our Philadelphia programs and our Philadelphia staff? So more information to really figure out there. All of this is so hot off the presses every minute, every day. And the states are playing catch up, so we're playing catch up and continuing to work with the information we have as it's coming in. Hopefully that answered the question, Sharon.
I don't see anything else in the chat, Marcus, so I'm going to turn it over to you for closing remarks.
Thanks, Sherry. So again, I want to thank everybody for their continued focus on what we need to be doing to ensure that we're keeping everyone in our care safe and each other safe and healthy during this time. It is complex, no aspect of this is easy. It is very complex, and we've been working with it for a long period of time. So I appreciate everybody's continued patience and commitment to working with us to make sure that we're doing what we need to do. As we end the call today, I do want to share something that I think is also just hot off the presses. If I could share my screen here. And this is really a reminder of how we started the conversation, as well as where I think is important for us to land. So I think everybody can see my screen. So this comes to us from Kelly G in St. Louis, Missouri, who I think probably put this together as we were talking here today. So I will share with you all again the ask that we all as a community inside our workspace, our work environment, but also outside of our work environment, because there's significant overlap, that we remember the 5 W's of wash your hands, wear a mask, watch your distance, and wait on gatherings. I'm sorry, 4 W's. Thank you, Sarah. I'm getting ahead of myself. Next week, we'll have a 5th one, I guarantee you. I'm getting ahead of myself. So 4 W's. Wash your hands, wear your mask, watch your distance, wait on gatherings. And with that, again, I thank you all for joining us and look forward to continuing the dialogue next week. Have a good day, guys.